Usually most of the cirrhosis of liver patient, there are three types of cirrhosis staging we call: child classification A, child B, child C. Now what is this all child all about? Basically, in non-medical terms, child A is early stage, child B is mid stage, child C is advanced stage. Now how do they present? They usually present right from top to bottom. If you just enumerate them, like loss of hair, we call it as alopecia. Then there can be jaundice, yellowish discoloration of the eyes and urine. There can be loss of taste. There can be loss of libido. There can be gynecomastia, that is breast enlargement in male patient because of excessive estrogen hormone. There can be loss of pubic hair or axillary hair. There will be distension of abdomen in the form of fluid accumulation called as ascites. There will be liver enlargement, spleen enlargement. Few patients may have dilated vessels over the chest. We call it as spider nevi. Few patients may have a swelling over the feet as a presentation. They start with the swelling over the feet and then the swelling increases over the abdomen and face. We call it as edema feet. Few percentage of patients may present with dependence contracture. Some patients can present with the complications of cirrhosis of liver as liver coma or hepatic encephalopathy. What happens in a patient who has cirrhosis of liver? They usually have ammonia metabolism which is controlled by liver. But in patients who have cirrhosis of liver, this ammonia which is produced in the gastrointestinal tract, instead of going through the liver, it bypasses because of the portal hypertension and cirrhosis of liver directly to the brain and leading to shutdown, brain shutdown, and then the patient lands up in a condition called as cirrhosis of liver with liver encephalopathy or hepatic encephalopathy. So the patient can present to you with altered sensorium, confusion, delirium, tremors, or in a stage of coma where the patient is not arousable. So it all depends on how the patient is brought to you. As I have told earlier, few percentage of patient can directly come with the blood vomiting, with the low blood pressure, difficulty in breathing. Few patient may present with black stool, we call it as melena. And few percent of patient, if they have massive bleeding, they can come with red blood per anal canal. Some patients can present to you with kidney shutdown, we call it as hepatorenal syndrome, as I told you. Few patients present with breathlessness, we call it as hepatic hydrothorax or hepatopulmonary syndrome. So there is a varied presentation in patients with cirrhosis of liver. They can just be asymptomatic and get detected on a routine ultrasound when they are going for some pre-operative surgical evaluation, or they are undergoing some mast cell checkup. They will come to know that they have got a cirrhosis of liver, and then they are guided to the gastroenterologist and they investigate, and then the further treatment is continued. Whereas few percentage of patients may present with just plain cirrhosis of liver with symptoms, or few percent may present with cirrhosis of liver with one or more of its complication.